This series of videos have been developed by Public Health Services. The sessions are designed to provide self-directed learning, and they cover the basics of infection prevention and control. This session is about hand hygiene. Following this session, you'll have an understanding of the importance of hand hygiene, as well as knowing when and how to do hand hygiene according to the Hand Hygiene Australia 5 Moments for Hand Hygiene. Hand hygiene is a critical element of standard precautions. Performing hand hygiene correctly and at the appropriate times can prevent or reduce the risk of transmission of infectious agents from one person or place to another. Hand hygiene refers to any action of hand cleansing and includes washing hands with soap solution and water, or applying a waterless alcohol-based hand rub to the surface of your hands. Alcohol-based hand rubs are convenient and are the first choice for hand hygiene in healthcare when your hands are not visibly soiled. To correctly use alcohol-based hand rub, dispense the amount of rub recommended by the manufacturer onto dry hands. Rub your hands together so that the solution comes into contact with all surfaces of your hands, making sure that your thumbs, the tips of your fingers, the webbing between your fingers and your wrists are covered with the alcohol-based hand rub. Continue to rub the solution into your hands until it is evaporated and your hands are dry. To do a routine hand wash with soap and water, wet your hands under running water and apply the recommended amount of liquid soap. Rub your hands together for at least 15 seconds, ensuring all surfaces are covered with soap and water. In particular, your thumbs, the tips of your fingers, the webbing between your fingers and your wrists. Rinse the soap from your hands under running water and pat your hands dry with disposable paper towels. Being bare below the elbows is recommended when you provide patient care that entails physical contact, when performing any procedure on a patient, or when performing hand hygiene. Bare below the elbows involves wearing short-sleeved clothing or rolling up long sleeves. Hands, wrists and forearms should be free of jewellery and watches, although in some circumstances a single flat ring may be worn. In addition to being bare below the elbows, nail polish and artificial nails are not recommended. Any cuts and wounds must be covered with a waterproof dressing. And remember, wearing gloves is not a substitute for hand hygiene, nor should hand hygiene be done whilst wearing gloves. Hand hygiene should be done at specific moments when providing health care. These are called the 5 moments for hand hygiene, and the moments are moment 1, before touching a patient, moment 2, before a procedure, moment 3, after a procedure or body fluid exposure risk, moment 4, after touching a patient, and moment 5, after touching the patient's immediate surroundings. More detail on the 5 moments for hand hygiene can be found on the Hand Hygiene Australia website at www.dhha.org.au. There are a large number of resources that can be found at the Hand Hygiene Australia website, including the HHA manual, educational and promotional materials. Hand Hygiene Australia also have a wide variety of online learning packages. We would highly recommend that you complete the relevant online learning package to learn more about the importance of hand hygiene in healthcare. To summarise, hand hygiene is a critical component of standard precautions. Hand hygiene refers to any action of hand cleansing, and it includes washing your hands with soap solution and water, or applying a waterless alcohol-based hand rub to the surface of your hands. Alcohol-based hand rubs are convenient and are the first choice for hand hygiene in healthcare when your hands are not visibly soiled. The 5 moments of hand hygiene describes the most critical times that you should undertake hand hygiene to prevent the transmission of organisms in healthcare. This session has been based on the Australian Guidelines for the Prevention and Control of Infection in Healthcare. Thank you to the Australian Commission on Safety and Quality in Healthcare for permission to use their standardised infection prevention and control signs.